back, everyone. Tonight we're focused on healthcare access with specific attention on National Health Insurance Authority. Unlike the previous law that was referred to as a scheme, this present act is called an authority, meaning it exerts authority and regulates health insurance schemes in Nigeria. There is so much power vested in the NHIA, ranging from the regulatory to supervisory as well as managerial. Tonight we're speaking with Dr. Kelechi Ohiri, who was appointed Director General and CEO of the National Health Insurance Agency by President Bola Tinubu in October 2023. Dr. Ohiri has previously served as a senior advisor to the Ministers of Health and Finance in Nigeria. He's a medical doctor. He also has worked as a primary care physician in various healthcare settings. His extensive experience in the healthcare sector spans clinical medicine, consultancy, and advisory roles in both the public and private sectors. Dr. Kelechi is a fellow of the 5th class of the Africa Leadership Initiative West Africa and a member of the Aspen Global Leadership Network. Good evening to you, sir. Thank you so much for joining us this evening. It's a pleasure having you on Politics Tonight.
Good evening. Thank you. Thank you very much for having me. Good evening.
Right. First, let's start from the basics. I mean, what we used to know was NHIS, that's the National Health Insurance Scheme. But now there is a new act, National Health Insurance Authority. Why this change, and what are the benefits to derive from this new act?
Thank you very much for the question, and also for the interest shown. And indeed, in 2022, the previous act was repealed, and the NHIA Act was put in place that established the National Health Insurance Authority. Embedded in this change is not just in the name, which changes from scheme to authority, but it recognizes the fact that in order to promote, to regulate, and to integrate insurance in the country, that it needed a much more enhanced and strengthened agency that can actually exercise these roles and responsibilities. One of the hallmarks of this act was to create a mandate for health insurance, to make it mandatory. And as a result, the NHIA is now charged with enforcing that mandate, but not only enforcing the mandate by making health insurance obligatory, but it also helps to integrate the various schemes in the country. We have a mixed health insurance landscape where we have public providers of insurance, the state health insurance schemes, and then we have private health insurance institutions, largely the HMOs. And so our responsibility is not just to regulate the sector, but is also to integrate and harmonize the sector and also promote insurance, health insurance in particular, as a means of financial protection and as a means of enhancing financial access to good quality health care for all Nigerians. And so this is the mandate we have, and it's one that we are taking really seriously, so that the out-of-pocket expenditure that arises as a result of the system we have where people do not have that insurance coverage is reduced to the barest minimum.
Right. So it's a fact that coverage has remained below 10% since the inception of health insurance initiatives in this country. And as we speak, Nigeria's insurance structure, both publicly and privately led, covers less than 16 million Nigerians. What plans do you have to increase this number? Would it be a case of mandatory national health insurance scheme or decentralization of the social health insurance system?
Thank you very much. I think there are fundamentally three things that account for the fact that, for the reason why health insurance has been low. And you're absolutely right. Since its inception as the NHIS until date, we still have less than 10% of Nigerians actually covered by health insurance. And this number has remained stagnant and almost difficult to break through. But there is hope in the sense that the Act actually makes it mandatory for the first time. Prior, it used to be voluntary, so only those who had the awareness or had the means of buying insurance actually were covered. But now by making it mandatory means that it's important and it's easier to actually expand coverage. But beyond the mandate, it's also an issue of awareness. More people need to understand what insurance is and how it helps them actually enhance access to care. And so we have our work cut out in actually increasing awareness in the population. But the third thing is the issue of trust, where if you're insured, you need to know and you need to have access to good quality services. So we can't have a system where if you have some form of insurance and you go to seek care, then you don't have access to care, either because the services are not available, or you have cases where people actually are denied access to care. So that trust needs to be built. So I think those three things need to be in place. On one hand, making it mandatory. Secondly, creating that awareness across the population. And then thirdly, ensuring that when people actually seek care, they actually get that care. So that's why we're working closely with other agencies that are responsible for what we call supply side, so the provision of those services, so that when you actually show up, that those services are available and that they are of good quality.
All right, so let's take it from the rare, so that when people show up, they get the quality of what exactly they're looking for. It's been 25 years since the establishment of the National Health Insurance Scheme, and 19 years since it was officially launched and began operation. The target of the scheme was to achieve universal health coverage for Nigerians by the year 2015. Obviously, that didn't work. Now that we have the NHIA, what modalities are in this act that will ensure, one, accessibility, affordability, and quality health care for all Nigerians?
Thank you very much. I think to answer your question, I think it's important to paint the bigger picture. One of the priorities of His Excellency Mr. President is universal healthcare coverage. That's why healthcare has been one of the priorities of this administration. This has been articulated by the Coordinating Minister for Health and Social Welfare through his Health Sector Renewal Investment Initiative that looks at a sector-wide approach to doing things, which means that we recognize the fact that all hands need to be on deck, and it's not just enough to have the supply side fixed. We also need to have the demand side fixed. And it has 4 pillars. One pillar is about governance. We need to create proper accountability structures. And this is not just governance from government, but it's also ensuring that there is citizen accountability to ensure that people actually get the care when they need. And if for any reason care is being denied, that there are mechanisms to actually seek redress. The second thing is the investment in service delivery. And there are many entities that are involved in this at the subnational level with the states, but also the coordinating function of the National Primary Healthcare Development Agency. And as part of the targets for that agency, and I will just not delve into that and allow the executive director speak at the opportune moment, is the service readiness, the rebuilding, and the ensuring that the primary healthcare centers in the country actually serve it, which means they have the right complement of commodities, of human resources, and actually the infrastructure to actually deliver these services. And thirdly, we have a pillar on the healthcare value chain. And Mr. President had appointed a national coordinator for the health sector value chain. And this is because we recognize the fact that the health sector is not just one that drains resources, but it's actually a productive sector, one that creates jobs, and one where we can actually unleash the innovation that exists in Nigeria through technology or through additional investments in the health sector. And that's also one where, when you look at the value chain, the payer value chain, where health insurance comes in, is one of the critical aspects of that. And then the last is health security, for obvious reasons. We've emerged in a world post-pandemic where we recognize the fact that where you need to build a health system, you need to ensure it is resilient enough to withstand the next onslaught by a pandemic or multiple recurring epidemics as we see. So what that means is that in the NHIA, we've articulated a 4-pronged vision, which is an overarching aim of increasing financial access. So first, we focus on enrollment, which you mentioned has been stubbornly low ever since the inception of the health insurance scheme. And what we want to do there is first ensure that we enforce the mandate. If people if employers, for instance, have 5 or more employees, it is important that they ensure that they have health insurance coverage. Secondly, we want to ensure that we build trust in the system, which I've already spoken about. And then thirdly is that awareness creation that ensures that we go beyond the formal sector workers and beyond the government subsidies to actually ensure that those in the informal sector, the SMEs, are actually also reached with health insurance products that enable them actually buy into health insurance and actually get covered. The second pillar is the equity pillar, where we're saying that we don't want insurance coverage to be just for the rich. We want to ensure that the poor and the vulnerable are part of this. And that's why there is a vulnerable group fund that came with the act. And in this year, His Excellency Mr. President has put in a budget for covering vulnerable populations. These vulnerable populations include the indigent.
Before we get to the vulnerable group fund, before we discuss that, what mechanisms are in place to ensure that even when services are denied, this is dealt with?
Thank you very much for that question. And this is something that is of a particular importance to the NHIA. First of all, if services should not be denied and people should not be denied care when they are covered by health insurance. Now, if such a thing occurs, our enforcement team in the NHIA stands ready, and there are numbers to call. We have a call center 24/7 with people ready to pick up and address that. If it means addressing the HMO, if it means calling the providers, etc. And in addition, if we investigate and find the provider wanting, there are specific sanctions that we have in place in our policies to actually make sure that such a provider doesn't repeat such, including taking away the accreditation of that provider to cover the scheme and ensuring that the persons covered are moved to a different provider. So there are a series of measures and steps to be taken in that regard. Secondly, it's important that people understand their rights. So I cannot overemphasize the need for awareness creation, for people to know what to expect when they go there. And that agency is something we're trying to ensure that the average Nigerian who is covered by health insurance has when they go there. So with those two things, we're sure that this practice of people being denied care, it becomes a thing of the past, because it's one that the NHI is very particular about and very focused on. And thirdly, we're beginning to address some of the reasons and the sometimes excuses that are given for denial of care. For instance, tariffs being low, or premiums, gaps in premium coverage. And we are taking specific measures, including commissioning actuarial studies to review the existing benefit package and to review tariffs, so that we make sure that the cost of providing care and the actuarial cost reflects reality with the medical inflation we've seen over the last year.
Right. So just as you were saying, I know the authority mandates participation in health insurance for every legal resident of Nigeria, irrespective of employment status, as opposed to the former NHIS law, which was voluntary, and beneficiaries were basically those employed in public and organized private institutions, especially the federal government, civil servants, and their dependents. How does this new act bridge inequality?
Thank you very much. You're right in that in the early stages of the NHI, a lot of focus was on what we would call the formal sector. So typically employers providing a benefit of health insurance for their employees. And that means that for many of the indigents and many of the poor who do not have any formal employment, some of them were excluded. And this was the second pillar I was going to speak about, because in recognition of this, two specific schemes have been put in place. One is the Vulnerable Group Fund, which targets vulnerable populations, which include the indigent, but it also includes other people such as internally displaced persons. It also includes the disabled. It also includes prisoners and other groups that, by reason of different circumstances, have become more vulnerable. And it also includes sometimes pregnant women, because we have high rates of maternal mortality and morbidity in Nigeria. The second program is the Basic Healthcare Provision Fund, which has been, which was passed, I think, in 2014, and part of that is as part of the National Health Act. And what that does is that 1% of consolidated revenue goes into primary health care. Half of that, 50% approximately, goes towards providing health insurance for the poor and vulnerable. And recently, the latest tranche of those funds were transmitted or was approved by the Ministerial Oversight Committee and will be implemented at the state level by the state health insurance agencies to make sure that the poor, those in the social register, and those who they've identified through community targeting are covered, and that we can actually expand insurance to the poor, so that it's not just the wealthy and the rich that are covered by insurance. So those are two very concrete mechanisms that we're using to ensure that the equity perspective is brought to bear, and that the expansion of insurance is not just favoring those who are wealthy and those who have the means, but also the poor, the vulnerable, and other indigent populations in Nigeria.
All right, Doctor, does this act also provide an avenue to receive feedback from enrollees as regards their experiences with healthcare providers, perhaps to report dissatisfaction with services?
This is a critical part of what we're trying to do. And to do so, one, like I mentioned earlier, we have call centers that, take the feedback from people. Secondly, we're enlisting civil society to serve as, another layer of accountability, so that, if they observe any of these practices, they can also reach out to the NHIA in that regard. So measures have been in place, and we're actually stepping up these measures to ensure that this becomes a critical part. And the Honorable Coordinating Minister of Health and Social Welfare last week actually even provided a number, I don't have it on hand now, that's for the civil society, almost like a whistleblower number, so that if you see anything untoward that is happening, you can actually call that number directly and make your complaints, and it will be acted upon.
All right, so as soon as you have the number, kindly get it across to us. Thank you. Now, talk to us about the establishment of the Vulnerable Group Fund. I learned the beneficiaries were or would be gathered from the social registers of each of the 36 states of the Federation. How do you arrive at the lowest of the low in our society, those who really need this fund?
Thank you very much for that. So one of the important things to note about health insurance is that it's a form of non-contributory social safety nets, which means that as part of the basket of services to help the poor, health insurance is one, and there are other government programs. Some work had already been done through other programs to create social registers in states, which look at multidimensional nature of poverty and deprivation, and ensure that households and families that fit that category are captured in the register. So the register is sort of the first line, but we're not limited to that. And that's because, like every database, it needs to be renewed, it needs to be validated continuously to make sure that those who are in it are actually eligible for the service being provided. So in many of these instances, we work very closely with our state counterparts, the state health insurance schemes, and we do a combination of a first cut at the social register, but more importantly, community targeting, because we know the communities. Communities know the most vulnerable amongst them. And that engagement with the community not only fosters accountability, but also ensures that real time we are identifying those most vulnerable within the particular villages and wards in Nigeria, and those are people that are brought in. A third layer of ensuring that we capture the right people is through the service delivery platforms, the primary healthcare centers, where we have families that may show up, can't afford the most basic of services, women who can't afford to pay for deliveries that show for antenatal care, children who are being treated for malnutrition, as well as what is called zero-dose children who have never even had any immunization or the first dose of immunization, because that's an index of multiple deprivation. So there are very clear ways that have been engaged to ensure that those who benefit from these programs are actually those who need them the most. And it's not one that is subject easily to capture by those who are ineligible for them.
All right, quickly, when will this program kick off, or has it kicked off already?
It has kicked off already, and for the Basic Healthcare Provision Fund, that has been going on. We're currently at a stage where learning the lessons from the first phase of implementation. We are trying to redesign by ensuring that programmatic aspects, operational aspects, and fiduciary aspects are adapted to suit the current environment. And so last week, Thursday, was a moment where the Ministerial Oversight Committee actually approved funds. On Friday, I will be having a meeting with the chief executives of all the state health insurance agencies to actually look at implementation plans for this current phase of implementation, so that there is alignment, and in that way we are performing our role as not just a regulator but also integrating different schemes, so that there is some common foundation and alignment on how we approach that. And every state in Nigeria has passed laws to establish these state health insurance schemes
All right,
that will help
Dr.
drive this.
Let's take a break. Let's take a break, and when we come back, we will continue this conversation.